Hi, everyone. We're back today with Tripod Thursday. It's a very exciting day. We have on Dr. Kim. She is a naturopath in the Toronto area. Hi, Dr. Kim.
Hey, Melissa. Thanks for having me here.
Oh, you're very welcome. Thanks for taking the time out of your day to come on and discuss your area of expertise.
Mhm.
So can you tell our viewers a little bit about your field and what you do?
Sure. So, as you mentioned, I am an integrative reproductive health expert and naturopathic doctor by profession. So, I practice naturopathic medicine. That's what it means. I can let you know a little bit about what naturopathic medicine is. It is a system of primary healthcare where we use a combination of modern medical and scientific knowledge and natural therapies in the prevention and treatment of illness because we believe that the body, when encouraged, it can heal. It can heal quite well with these supportive therapies.
Okay, great. Thank you for that. So how can you help patients that are experiencing infertility?
Sure. So I help people facing fertility challenges or just general overwhelm with their reproductive health issues by providing informational and practical support on how they can overcome their challenges. So my expertise enables me to connect them with a variety of tools based on their individual needs. Um, the way I kind of describe it is that we work together to first identify what obstacles are affecting their health. Then we can consider incorporating some tools that are evidence-based that can improve their markers of health. We provide education and counseling so they have a clearer understanding of how we can meet their goals. When I say we come up with a management plan, that always takes into account someone's unique needs. So someone's physiological, structural, psychological, social, other factors really that can affect someone's experience of their health. Right. So, and depending on the person I'm working with, their comfort and inclination, I also suggest incorporating things that are integrative in nature. So things like botanical or plant medicine. I am a big fan of providing support for modifying diet and lifestyle. That's realistic, of course. Um, Acupuncture is a big one among my fertility patients as well. Also a big fan of nutritional supplementation and body work. And so, those are just some of the things that I include in my treatment plan. Ultimately, it's a well-rounded type of support wherein we address those needs and we check in and we can scale up or scale down depending on how those things fit their needs. That makes sense.
Yeah, no, that's really great. You provide a lot of different services, which would be quite
Hmm.
helpful.
Hmm.
Yes, thank you for that.
Thank
So
you.
can you take me through your process if you were to treat someone that had PCOS, and how would you go about assisting them?
Yeah. So PCOS, as many of you maybe are familiar, we have to remember that PCOS is a very complex hormonal disorder. And so this means that we have to identify what factors those someone may be facing when it comes to their own unique experience of PCOS. So what I do is I take a deep dive at someone's fertility and reproductive health history. We review all available lab work. We assess their overall health history as well. And what that does is, it allows us to gather enough information in this portion of our work together to piece together clues on, what may be the dominant hormonal or other health issue that could be, stalling someone's success with fertility and pregnancy. Um, for PCOS, what I commonly narrow down is whether or not someone's case may be driven primarily by things like insulin resistance or high testosterone or androgen levels, or if it could be like an undermanaged thyroid issue, an undermanaged stress issue, inflammation, and so on and so forth. So, once we're able to determine more clearly what that main driving issue is, then we can formulate a management plan that honors those needs. And we restore fertility in the process and promote a healthy pregnancy. So just a little side note with PCOS, sometimes there is that implication that someone's experience of pregnancy may also be impacted based on their pre-pregnancy history. So like I previously mentioned, the plan can also involve several integrative therapies. Again, it could be a combination of diet and lifestyle, supportive modifications, nutritional supplementation, comprehensive lab work, which I often kind of include fasting insulin all the time, acupuncture, bodywork, and so on and so forth. Yeah.
Great. No, I really appreciate that overview. That was really helpful. I know a lot of people are going through PCOS, so there's kind of assistance and kind of plan that you could help them would be really good for them. Definitely. So what resources would you recommend for those going through infertility?
That's a really good question. And I don't think there's a right or wrong answer, because ultimately resources will look different for everyone. So if you're looking for mainly informational support, there's lots of fertility and reproductive health medical authorities, societies that offer short lists of information that you are looking in particular. I often refer to the fertility and sterility resource page for like more scientific gist of things. Maybe an easier way to digest those things is going through fertility sources like fertilitymatters.ca, Resolve Foundation. But if you're looking for more digestible, more approachable pieces of information that's communicated, I guess in a more friendly manner, or like less technical way. I actually really like the Egg Whisperer Show podcast and their YouTube channel. I like Ashley Levinson, who is also PCOS Girl, PCOS Girl's Guide to Life. And depending on how you feel about things like forums, sometimes social media forums can be an invaluable resource for those looking for community support. I also want to promote my own my own resource page. I'm actually in the process of revising my own little page of fertility resources. It's currently under construction, but I've often referred to fertility clinic websites like Tripod in this regard. So yeah, it could be really depending on what you're looking for, to be quite honest. Yeah.
It's true. It's very specific in a sense of what each patient wants to gain from it as well. It's just, but those are great examples. I know patients are always asking for different types of resources. So it's good to have those examples that you suggested.
Thank you.
So how would we get in touch with you?
Sure. So I am reachable via my website, which is kimabog.com. Email as well. There's many ways to send a message to that, and I respond directly. I'm also quite active on my social media pages, particularly on Instagram and Facebook, and slowly in YouTube as well. And then maybe in the next few months through Tripod, right?
Yes, definitely. Okay, great. Well, thank you so much for your time. We really appreciate it. I know you're quite busy with different patients, but thanks for coming on, and I'm sure we'll be in touch soon.
Thanks, Melissa. It was great to be here and just talk to you as well. Thank you.
Yes, no, definitely. Enjoy your afternoon, Dr. Kim.
You too. Take care.
Thanks. Take care.